Good morning, everyone, and welcome to this edition of MacroPro and Friends. For those of you who don't know me, my name is Diane Cohen, and I'm the Vice President of Client Services here at MacroPro. We are a document retrieval company. We can get records for your litigation and your claims files, regardless of where they are, whether they're nationwide or worldwide. We can do that. Today, I'm joined by my colleague, Wendy Stevens. So I wanted to let you know that your certificates will be coming via email tomorrow. If you have any questions for our speaker, you may put those questions in the question box, and Wendy or I will ask our speaker those questions at the end of the presentation. Handouts are attached to this webinar, so please download them now so that you have them so you can follow along and you can use them as reference material in the future. And then lastly, there'll be an encore performance of this presentation on the MacroPro YouTube channel later next week. Hi, Wendy.
Hi, good morning.
How are you?
I'm great. Happy Thursday.
Happy Thursday to you too. I hope all is well. And we look forward to hearing from you and your speaker. And this is our first anniversary of the pandemic. So I'm hoping that, everything's been good for you and Gen X.
Yeah, everything's been good so far. Very challenging year in 2020, but I'm happy to say, my family and close friends, everybody's made it through so far, so good. So yeah, looking forward to 2021 and trying to get back to a new normal. Yeah.
Absolutely. Well, we have 5 different webinars today. So if you as an attendee are going to join us for a couple, we're really glad for that. And for those that are going to be joining us for all 5, we look forward to seeing you at each of the sessions. All right, Wendy, if you'd introduce your speaker.
Yeah, okay. So Marianna Kritsberg will be doing the post-traumatic stress disorder presentation this morning. She is our branch manager over the field case managers in Northern California. She's a registered nurse with a master's in social work and also is a licensed clinical social worker. Her knowledge and vast experience is valuable to us and the community. Marianna has been with Gen X for 6 years, and we are so proud to have her on our team, especially in 2020, where she led the team of nurses through some very challenging situations, as we all know, and with success, which is great. So I'm going to hand it over to you, Marianna. Welcome.
Thank you, Wendy. Hi, everyone can see me okay? Thank you, Wendy. All right. So we will be talking about post-traumatic stress. And I know all of you have heard about post-traumatic stress disorder. Like Wendy said, I'm a branch manager for Gen X for Northern California. We have around 120 nurses, nurse case managers in Northern California, and I work with them. My first career was as a therapist, as a licensed clinical social worker, and I actually worked for the Navy for a while in Washington State. So post-traumatic stress disorder was my focus for many years. As I worked there during Iraq war, so Iraqi deployment. So let's talk about post-traumatic stress. Something's wrong, sorry. All right. So as part of this webinar, and I'm used to doing presentations in person, which I love talking to people, love meeting new people, but unfortunately, as we know, this year has been very challenging. So hoping we can resume our in-person presentations soon, but for right now, we're gonna make this do. So I don't expect you to remember everything I say or to read every slide, but I want you to kind of get an idea about post-traumatic stress and how it affects our injured workers in this field. Basically understand how it impacts their life, how it impacts their work, and identify some strategies that we can do to ease their work and kind of make their transition back to work more successful. So what is post-traumatic stress? Basically, it's an experience, it's a condition that happens after somebody experiences some kind of a traumatic event. So serious accident, terrorist act, mass shootings, war, rape, any kind of other violent personal assault. And post-traumatic stress doesn't happen to everyone, even after those traumatic experiences. An example of such experiences could be Gen X was involved in de-escalating some San Bernardino shootings. If you remember, shooting that happened in Vegas in one of the hotels, a YouTube shooting on a YouTube campus, and several school shootings. Unfortunately, a lot of things happen in California and in the states that are close to California, such as Nevada. And so we had to get out and help with some of those incidents, hoping to reduce the possibility of PTSD and reduce kind of the stress and ease the injured workers way back into work. Like I said, PTSD doesn't happen to everyone, even after they experience post-traumatic stress. Normal stress is absolutely normal after we experience some kind of traumatic event, but it's a perpetual symptoms that become a PTSD, and usually those symptoms happen several months after the traumatic event, and they last for a while. So for us to diagnose PTSD as mental health professionals, you have to have symptoms lasting a month straight. And we're going to talk about what those symptoms are. But, you know, regular shock, anxiety, stress after any kind of traumatic event is normal. But when they last a month straight without going away and actually getting worse, that's when we diagnose PTSD. Those kind of symptoms can happen anytime, you know, and usually they actually happen later after the accident, after the person kind of gets back into the routine. It could be 3 months, it could be a year, at any amount of time. So PTSD, we didn't even used to know or identify PTSD until about 70s. I'm sure you all heard about shell shock and combat fatigue. So they started talking about it during World War I a little bit, and mostly during World War II. But PTSD, as we know it today, came into use in 1970s. In large part due to Vietnam veterans. So what happened? So in World War II, World War I, you had, you know, a lot of people were involved in this war. A lot of people came back injured. A lot of people witnessed some atrocious, horrible events during the war. They came back, and still we didn't have as much PTSD. And that's when it became apparent why it happened when we talk about risk factors. So World War I, World War II veterans were celebrated, right? So that's the phenomenon that I want to talk to you about. Being in the Navy, I saw a lot of this happening. So they came back celebrating. This war was kind of accepted by the community, was celebrated everywhere in the world, the victory. So they had the support, that's the key word. They had the support when they came back from this war. And so not as many experienced what we know today is PTSD, because they had that overwhelming support and celebration, and they felt welcomed. Why we started to see so much of it more in 1970s after the Vietnam War is because those Vietnam veterans weren't as celebrated, they weren't supported, okay? And so a lot of them experienced the PTSD symptoms, because PTSD risk factors, one of the largest risk factors for PTSD is lack of support system, okay? So I just want to kind of talk about it a little bit, because people ask, you know, there have been wars throughout centuries, and so what happened? Why did it become so apparent lately and not before? Because of that overwhelming support after World War I, World War II especially, and not as much support after Vietnam War. So the term itself, the PTSD term, became recognized by American Psychiatric Association in 1980. About 7 to 8% of population suffer from PTSD during their lifetime, anytime during their lifetime. So it's about a little over 5 million Americans experience PTSD every year. And interestingly enough, women are twice as likely as men to experience PTSD. So 1 in 10 women are affected by PTSD, and 1 in 25 men. affected by PTSD. So, and we just talked about that. All right. So I mentioned it a little bit. So PTSD will most often begin about 3 months after the traumatic event, but it can happen actually a year, 2 years, something, years later after something triggers them. So most people will experience or who witness or experience traumatic or catastrophic event will experience some kind of difficulty with coping. They will have shock, denial, fear, anxiety, any of those symptoms, and hopelessness. And usually those responses are absolutely normal. What I like to say is this is a normal reaction of a person to an abnormal situation. So they experience those symptoms, but that's normal. We all experience them. If we see something scary, something absolutely horrible, we all get anxious, we all get stressed, we all get shocked, nervous, angry, if you will, and then those symptoms get better with time. However, with an individual who has a PTSD, those symptoms do not get better in time. In fact, they get worse in time. And so they're basically, what PTSD is, if you will, is they're reliving the same event. So let's say somebody got attacked at a convenience store at a gunpoint. And so they actually keep reliving that attack over and over again. And it's just as intense. So every time something triggers them, let's say they see a similar store or they see a person of a similar appearance, they relive the same event. So they are being attacked again at a gunpoint, and it's just as intense over and over again. This is what PTSD is. So it's not just being anxious and nervous or, being angry about something that happened. It's actually those vivid memories come back and you relive the same event just as intensely. So that's what PTSD victims experience, okay? Just a second, let's move for the screen. So symptoms of PTSD include several things. So intrusive memories, avoidance, hyperarousal, and negative alterations in cognition. And so what do we have as intrusive memories? What I just talked about. The individual is re-experiencing the same event. Why does it happen? So they see something, like I said, that triggers them. It could be a smell that they associated with that event that happened before. It could be an anniversary of the event. It could be somebody passing by that resembles somebody who attacked them. Anything can really trigger it that they associate with the event. So, and that memory comes back, and it comes back just as strong as it was when it happened. So avoidance is the other thing that characterizes people that have PTSD. So because those memories become so intrusive and they're triggered by certain things, people try to avoid everything and anything that could trigger this memory, right? So they start to avoid others, they start to avoid different places, they start to avoid anything that could potentially trigger. And life becomes very hard because you're really trying to navigate kind of between things that can possibly trigger your memory. And again, remember that memory is just as strong as the event that happened. So they're getting attacked over and over again, and they're trying to avoid it. So hyperarousal comes with that as well. So what's hyperarousal? They're basically chronically anxious because they're anxious that something could trigger them to have this intrusive memory again. So they're very anxious. They're basically on a state of high alert all the time. And they're trying to avoid that danger that they feel they could get anytime. So they're chronically anxious, chronically at high alert state. That can cause drinking, drug use, in order to try and basically self-medicate yourself. They're trying to calm themselves down. And what do people do when they try to calm themselves down? They might drink, they might start using drugs, they might drive very fast, recklessly to try and get away from that danger and so forth. So Some aggressive behavior, angry outbursts, anxiety, panic attacks can happen as a result of hyperarousal. And then they start thinking negatively about themselves, which is the negative alteration, negative thoughts and feelings about yourself, because they feel like they can't deal with it. They feel that they're not worth it, that something is wrong with them. That's why they keep reliving the same event. So they really detach from others. They kind of try to get away from everyone. They blame themselves, and that can cause also some suicidal ideation. So all those are symptoms of PTSD, and they happen, like I said, they need to last for a month or longer in order to diagnose PTSD. Okay, we talked about that individual is reliving or re-experiencing the event over and over and over again, and it's very real for them, very real. Okay. We talked about avoidance for a little bit. So the person is trying to avoid everyone in order to avoid all those triggers. Okay, hyperarousal, negative alterations in cognition and mood. How to identify those at risk of PTSD. And I mentioned risk factors in the beginning, and I will touch on them again. So a doctor can diagnose PTSD, a psychologist, a therapist, a psychiatrist. People who are familiar with PTSD, medical professionals, can diagnose a PTSD. Remember, not everyone will develop a PTSD. Just because somebody experienced a traumatic event doesn't mean they will have PTSD. They might be anxious and nervous for a little bit. They might be angry. They might be in shock for a little bit, but not all of it becomes PTSD. PTSD only happens to some people, some folks, depending on the event, depending on the other risk factors, and that becomes kind of a long-term illness. But not everyone will develop PTSD. Most people recover without any intervention, just with the support, and we'll talk about with other things that they have in the environment. We talked about that for the symptoms to be considered PTSD, they have to last for more than a month, and they have to interfere with their functioning, either at work or in their life. So which you can see that it will interfere. If they're trying to avoid all the triggers, if they have those intrusive memories that they keep reliving and reliving, they have that hyperarousal, they're always on high alert, and they have those negative cognition alterations where they don't think much about themselves, that gotta interfere with their everyday life and with work, okay? And there are some risk factors and resilience factors. So some people are more likely to get PTSD and some people are less likely to get PTSD depending on those risk and resilience factors. So let's talk about those risk factors. Of course, living through dangerous events and traumas is a risk factor. Getting hurt, seeing people hurt or killed, having a job that increases risk of seeing those traumatic events. Like I said, I worked in the Navy base for a long time, and I saw people leave for deployment for Iraq and come back from deployment, and they came back a mess. They came back after seeing those events, those traumatic events, and they really needed some help and support. So the kind of job that people have, military, first responders, police, increases that risk. Childhood trauma or abuse can increase the risk because that also triggers when the person experiences some kind of traumatic event as an adult. Feeling horror, helplessness, extreme fear, lacking a good support system of family and friends. So remember when I talked about World War II versus Vietnam War, that support system made a world of difference for those veterans. So having a good support system, being welcomed, having people who are supporting you and kind of around you and trying to help makes a world of difference. And it's a huge risk factor for PTSD. So a person who experienced a traumatic event and has no support and has no one to ask for help is more likely to then later develop into PTSD. So dealing with extra stress after the event, such as the loss of a loved one, pain or injury, loss of job, or a home, that also increases, of course, the risk. Having a family history of mental health issues, including anxiety and depression. So if a person already has a history of depression, they're more likely, when they experience a traumatic event, to feel bad about themselves, to get depressed, and then to experience PTSD as a result. Okay, and history of substance abuse, or history of drug use or alcohol use, like we talked about. Having negative feelings about oneself or having hyperarousal could cause a person to start abusing substances. They're trying to self-medicate. They're trying not to be anxious all the time. They're trying not to think badly about themselves. They're trying to forget that a traumatic event and not think about the triggers, and so they start using and abusing substances. Okay, so resilience factors. And those are exactly the opposite of what we had in risk factors. So what can help reduce the risk of PTSD, right? And those are seeking out support system. Sorry, moving some slides around. Seeking out support from other people, such as friends and family. And again, think of that example of World War II veterans versus Vietnam veterans. So you have support, if you have the support, if you have a support system, if you have a welcoming feeling, you're less likely to develop PTSD. Finding a support group after a traumatic event. So finding a group of people who have experienced a similar event and talk about it, basically. Support groups really, really help, especially those self-help support groups are absolutely amazing. I led for many years a support group for hospice, for survivors, basically, of hospice. And it was amazing how much they helped each other. They didn't even need me there. They helped each other. They talked about what happened and kind of how they went through this. So same thing here, finding a support group of people who experienced a similar event and talking about it. Learning to feel good about one's own actions in face of danger, having a coping strategy. And that's what one of the treatment actually is, and we'll talk about it. One of the treatments for PTSD is cognitive behavior therapy, which helps you develop coping techniques, okay? Being able to act and respond effectively despite feeling fear. So all those are resilience factors, and they reduce the risk of PTSD. So let's talk about the protocol. For treating PTSD. Like we talked about, PTSD is not diagnosed at least 1 month until at least 1 month has passed since the time of the traumatic event, and the person has had those symptoms getting worse for at least a month. So short-term anxiety, anger, depression is normal after a traumatic event. It's when it goes beyond 1 month and those symptoms keep getting worse. So PTSD affects people differently, of course, depending on those risk factor, resilience factors. So treatment needs to be different for different people, depending on what they're experiencing. All right. So let's talk about goals and treatment options. So the goal of treatment for PTSD is to reduce physical and emotional symptoms and include daily functioning. Remember, we talked about how those folks keep re-experiencing that event. That definitely interferes with their daily functions, because all their life becomes about is trying to avoid those triggers so they don't re-experience the same event, okay? So helping the individual better cope with the traumatic event that triggers, okay? And those triggers is what the goal of treatment is. Treatment options. And so let's talk about treatment options. They do what I mentioned, cognitive behavioral therapy, so psychotherapy. CBT is the most common treatment option for PTSD. And that's because CBT, cognitive behavioral therapy, and I used to teach that for many years. So cognitive behavioral therapy is typically a group therapy. It can be done one-on-one as well. And it's about 9 to 12 weeks. That's what it takes. So cognitive behavioral therapy teaches the individual basically to recognize, so cognitive, to recognize the triggers and to deal with them. It's very similar to, if you will, to anger management therapy, but in a different way. But the principle is similar, to where they recognize the triggers and they recognize how they start to be triggered. So let's say they smell something that reminds them of that, I don't know, of that traumatic event. Maybe that's how it smelled the day it happened. And then they start themselves feeling, let's say they start feeling sweaty palms, sweaty hands, okay? So they're recognizing they're starting to get triggered. They're starting to be anxious. And then if they recognize it and stop and do breathing exercises, or stop and remove themselves from that situation, then they can avoid re-experiencing that same event. So cognitive behavioral therapy basically teaches them how to recognize the triggers, recognize your body's reactions to those triggers, and then how to avoid that and deal with that, basically, and what to do. So breathing exercises, or removing yourself from that particular situation, and so forth. But that's what cognitive behavioral therapy is. So like I said, 9 to 12 sessions is usually normal. Medication. So let's talk about medication. We talked about a person being anxious or being depressed, right? Even going as far as suicidal ideation as part of PTSD. So medications for PTSD would include antidepressants and anti-anxiety medications, okay? So we're talking about Prozac, Paxil, Zoloft, Effexor, and some kind of maybe benzodiazepines for anti-anxiety, okay? So those are the medications we use in treatment of PTSD. Most of providers use a combination of both. Therapy, so you're doing CBT, cognitive behavioral therapy, and a combination of medications. Could be antidepressants and anti-anxiety, or just antidepressants and just anti-anxiety medication. So a provider would decide, depending on the person's history and how the person responds, what the best treatment option is. There is also eye movement desensitization treatment, EMDR. Basically, that's a guided eye movement, and that also helps with desensitization, okay? So trying to desensitize yourself to those triggers that trigger the people to be in high alert state. So those are the treatment options for PTSD, okay? So let's talk about PTSD and how it affects return to work, and what we can do to kind of ease people's return to work, if possible. So if a person has PTSD, they really have an extremely difficult time returning to work, especially if the traumatic event happened at work. But research also shows that employees who are not able to return to work experience more persistent PTSD symptoms. So returning to work and trying to normalize your life back actually reduces PTSD symptoms. As hard as it might seem, and as hard as it is for some of those folks to return back to work, especially if the traumatic event happened at work, research shows that coming back and getting back to work, just like with any other job injury, actually reduces the risk of depression, risk of anxiety, and PTSD symptoms. So the individual can remain in that cycle where the PTSD symptoms are preventing them from returning to work. And then, of course, their absence from work is negatively impacting their ability to overcome PTSD. This is what I was talking about. It's like a cycle. So they're having a hard time returning to work because maybe the incident happened at work or close to work or on their way from work, but not returning to work is actually making their PTSD worse, PTSD symptom worse. PTSD, symptoms of PTSD can interfere with the individual's ability to work in many ways. So you have memory problems, lack of concentration, poor relationships with coworkers, trouble staying awake because maybe they had trouble sleeping at home because they're re-experiencing that event. fear and anxiety, panic attacks, emotional outbursts, flashbacks. And due to that, absenteeism. So they might be missing work because of all the symptoms and all the risk factors, okay? So what are the strategies we can do to ease this injured workers' return to work, okay? And we just talked about all of those slides. So memory problems, lack of concentration, and so forth. So discussion of kind of any workplace accommodations. What can we do to help the individuals return back to work so we can reduce their PTSD and kind of get their life back to as normal as we can, okay? Providing instructions and verbal instructions and additional restrictions, maybe a refresher training. So take it slow, get some additional training for them, some verbal instructions, and keep retraining if needed. This is one thing that we can do. We can try to allow, and if that's possible in the job that they're doing, more flexible schedule for that injured worker so they can take time off for the treatment appointments, right? So they will be going to that cognitive behavioral therapy appointments, which is usually once a week for 9 to 12 weeks. So let's try to be flexible to allow them to go to that treatment, okay? Maybe permitting extra time to complete tasks that are not urgent. If an individual experiences a traumatic event at work or maybe outside of work, and where they work is very noisy, very high stress, very noisy, wearing noise canceling headphones will help to reduce their distraction, right? The noise might be a trigger for them. So wearing those noise canceling headphones will reduce those triggers. Increasing the amount of light. They might not be comfortable working in a darker place. Increasing the amount of light also helps with alertness and concentration. Where possible, removing those environmental triggers that remind them of the traumatic event. So somehow reducing and maybe removing loud noises. Again, maybe headphones will help. Something that triggers them. The less triggers we have, the more likely they are to be functioning more normal and not having the risk of re-experiencing that event in their memory. Making sure that the parking areas are well lit, and maybe security personnel to escort them if needed, if they do work late. So those are all the things that we can do to ease their return to work, okay? Case managers. So when I work with our nurses and our case managers, we talk about PTSD, how to identify if the injured worker that they're working with possibly has PTSD. How can they help them to return back to work? Because like we talked about, not returning back to work for this individual is actually worse. It gets their PTSD worse. But returning back to work can be very, very difficult because they're triggered by different things and they're basically re-experiencing that memory, that event. So our case managers are very good in recognizing those triggers and recognizing those symptoms and aiding that individual to return back to work and letting the accounts, the adjusters know that this is what might be happening. Maybe we need to get this evaluated. So again, I don't expect you to remember everything we've talked about in this presentation, but kind of get an idea of what PTSD is, what reduces the risk factors. Think about World War II veterans coming back versus Vietnam veterans. PTSD overall wasn't recognized until 1980, okay? So all the stress and anxiety that people were experiencing as a result of traumatic events, it wasn't recognized. People just thought, well, it's normal anxiety, normal stress. You know, you came back from war or you came back from whatever it is, and you're just going to be fine in a while. And if a person truly has PTSD, it's not going to be fine in a while. It's not going to be fine without treatment at all. In fact, an individual, if you remember, might start abusing substances, drugs. They will not get back to work because they're reliving the same event. They're fearful. And they might even have suicidal ideation. So it's very, very important to get them the help that they need. And remember those risk factors and those actually factors that reduce it. Support is a big one. So having the support, having a manager who understands and kind of tries to accommodate that person back to work, having the support at home, finding a support group if possible, all of this helps a lot. And it's not just words, it actually does make a world of difference for this individual. So, additional information that you can find on PTSD can be found in all this sources: National Center for PTSD, American Psychiatric Association, and this is the first association that recognized this as a disease, I believe in 1980, but American Psychiatric Association, American Psychological Association, National Center, Institute of Mental Health, and U.S. Department of VA, Veterans Affairs. VA has done a lot of research on PTSD and how it affects veterans. And what we talked about, the difference between PTSD when veterans came back from World War II versus Vietnam and other wars that happened. So U.S. Department of Veteran Affairs is a huge, huge resource for PTSD information. This is where I got most of my information. Summary, we just talked about it, how basically PTSD is a disease. It's very real, and it does not get better on its own if a person truly has PTSD. Not everyone who experiences a traumatic event will develop a PTSD. Some feelings of anxiety and fear and anger are normal after a traumatic event. You experience something traumatic, it's normal for you to be angry, anxious, and so forth. It's not normal when it happens, when it lasts for more than a month and those symptoms become worse and you keep reliving the event. That's the one characteristic of PTSD, is that people keep experiencing the same event and it's just as intense as when the event actually happened. So just remember that. It doesn't go away. They have PTSD. We do need to get them some treatment and some support. This is my contact information. If you have any questions, please feel free to contact myself or Wendy. I don't charge for advice, so if you need any help, please. Diane, do we have any questions?
I think we do. Wendy, can you ask those questions?
Absolutely. I have one question, Marianna. Should CBT be approved for beyond 12 weeks if the employee is not improving? And the second part to that is, what's the absolute max that an employee should attend CBT?
The max is pretty much 12 weeks. And that's what I say. If your person has been seeing a therapist for more than 6 months and they're not improving in any mental health condition, find a new therapist. It's not working. This is not the psychoanalysis, Sigmund Freud days where we're going to be talking to a therapist for years and years and nothing happens. If you've been talking to a therapist in any mental health condition for more than 6 months and nothing is improving, you need a new therapist. Therapy, just like cognitive behavioral management and many other therapies, should be short, time focused, and goal focused, goal oriented. There has to be a goal of what we're trying to achieve at the end. So it shouldn't last forever. 12 weeks is pretty much what CBT should be. If a person maybe missed a couple sessions or wasn't very successful with a few sessions, maybe they had different symptoms or something happened, yes, a few extra sessions could be approved if the therapist thinks it will be beneficial, but on average, it should never be more than 12 weeks.
Okay.
And they probably need medications. They need some kind of combination of other therapies with that, okay? If they've been there for 12 weeks, they participated, they tried, and it's not working, then that's not the therapy for them.
Okay, so the second part of the question is, the other question is, if an employee has the anger and the anxiety and the stress right away, is that indicative that it's going to turn into PTSD, or can they work through that before that 1 month period?
Absolutely not. Like I said, it's absolutely normal for all of us. Imagine if you just witnessed a horrible car accident right in front of your eyes. We'll all be shocked and probably angry, and anxious for a while, right? But it's not going to last more than a month, and we're not going to keep reliving the same accident over and over unless we have PTSD. So if an employee has some anger and anxiety and shock, yes, of course, it's absolutely normal. It might not develop into PTSD. If we're supportive, we give them some time off. We try to remove those triggers from the environment and give them some time. They might come back just fine. Remember, only 7 or 8% of people will have PTSD out of all the population. Only 7 or 8%. It's not that prevalent.
Very interesting. Well, we'd like to thank all of you for joining us today. We'd like to thank our expert, Marianna, for her information, Wendy for helping us out today, my Wendy from MacroPro for being our question lady. As a reminder, I want to tell you that there is going to be an email coming to you tomorrow that says your certificate is here. Please make sure that you download that immediately. See you later. Bye-bye, and have a very safe day. Remember, wear your mask. Bye-bye.